Hello everyone, welcome back. Welcome back to another episode of GMP training. Last few classes we were discussing about the implementation of GMP, that is the history of GMP. Then we also discussed about the 10 golden principles of GMP. We have also seen the worldwide enforcement of GMP. And today, as a part of the GMP complaints training, we are going to discuss about another topic that is on the quality management. We will be going to discuss about the quality management today. So due to certain technical error, today I won't be able to come throughout with the video. So my video will be soon going to disappear from the screen, and we will be just interacting with you through my screen sharing option. So keep watching and enjoy the video. At the end of the presentation, there are discussion time where the joint discussion is required, where you can post your discussions, you can suggest your answers in the QA area. Okay, so please do that. So enjoy. So first we will discuss about why GMP. So for any training, we may have to repeat the need of implementing GMP and advantage of GMP. So GMP, the implementation of GMP will be ensuring the public safety. That is the most important thing. It will be ensuring the public safety. How it is ensuring the public safety? If a company, a manufacturing company, a pharma company or a food company or a medical device manufacturing company, if they have implemented a GMP, it will be ensuring the identity, safety, purity, efficacy, potency, stability and consistency of product. How it is able to achieve all the aspect? Yes, surely the answer is through GMP. We have already discussed about the main fundamental principle behind the GMP is quality is not ensured by testing the end product quality, but a system of quality is being implemented into the process. So by implementing GMP, the company can achieve top quality pharmaceutical product which are free of errors and risk. And that also will be increasing the efficiency. How it is increasing the efficiency? Just by reducing the wastage of products. Rejection of the product can be reduced. So product rejection can be reduced. Reworks can be avoided. If you have a very good written procedure for a process, the reworks can be avoided. Complaints and recalls can be effectively managed. So we can effectively manage the complaints and recall, and we can also reduce the complaints and recalls. And it will be increasing the competitiveness. So we know that the global market is growing so fast and the competition is also increasing vastly. So it will be giving you a cutting edge for your product. And we know that now it is a mandatory regulatory requirement to implement the GMP or ISO 9000 series into your manufacturing facilities. So we consider GMP as the minimum standard for drug manufacturing. So that is a brief overview again about the GMP, which we are discussed and we are familiar about it. Now moving on to our topic, that is quality management. Myself Srijesh, your instructor for GMP training, Assistant Professor, Department of Biotechnology, St. Aloysius College, Mangalore. So why I have put the World Health Organization logo here, you may be wondering. It is just to make you aware that the today's concept what we are going to discuss, the concept that we are going to discuss in the coming slide about the quality management are mostly based upon the WHO guidelines, and also some of the aspects, maybe we will be also discussing about the ICH guidelines, ICH Q7 guidelines, the definition part and all, how it is defining the quality management, that and all we will be discussing from the ICH Q7 guidelines. Okay. So these are the learning objectives. So by implementing the GMP into your production facilities, we know what we can achieve. And today's class, we are going to discuss about the key issues and relationship between the quality assurance and quality control. So after the completion, a successful completion of this video, you will be able to understand the key issues in quality assurance, good manufacturing practices, or quality control. And you will be also able to understand the specific requirement on quality management and quality assurance, like the role of organization, the need of having proper procedures and processes and resources, how effectively we need to do the resource management. So these aspects we will be going to cover in the coming slides. So this slide you will be able to see about a manufacturing process. This is a manufacturing process diagram where you'll be able to see we are starting with the raw material, then we are processing it. There will be different equipment that is being involved, manufacturing plant, operations, environment, manufacturing in process. Then there will be called testing, then finishing of product. After the finished product, they will be packed, and after package, there need to have a good storage, and you also need to have a good distribution practices that into the system as a part of the GMP. So we call it as a dispatch. So dispatch require a good distribution system through which a correct product will be reaching to the consumer. And when we talk about the quality, we already mentioned that according to the guiding principle of GMP, you cannot inspect quality into a product. What you need to do is it must be designed and built from the start. So from the start, that means from the raw material to the customer, there are different sequence of events and sequence of operations that is involved, where the different departments will be working hand by hand to ensure this guiding principle, that is quality is built or quality is designed into the production process. So to ensure that, there will be a hierarchy of managerial systems to ensure the quality. So in the pharmaceutical quality management, when we are talking, you will be able to see a hierarchy. There will be the top management, there will be statistical analysis, there will be strict corrective and preventive actions, and there will be the failure of analysis whenever if it is happening. Then you will make how you will be evaluating such kind of failures, whether it is happening. There will be annual product quality reviews. So this terminology is APR, APQR indicates about the annual product quality reviews. And there will be a deviation management team which will be identifying any kind of deviation from the GMP. So when we are implementing GMP, we have to see that any deviation that is being taking place. So you need to identify the critical points at which the deviation is being taking place, that we need to ensure. Then accordingly you need to change the control. The change control management is another concept. If you are identifying any deviation, then how we will be proposing the change. So the change control, how we will be proposing. Then the OOS management, it is nothing but out of specification management. That is, if any instrument or any equipment or any processes are out of specification, how we will be doing that management, it is called the out of specification management. Then we also need to have a proper management of complaint, the consumer complaint, and sometimes there will be recall management. And also we need to have a validation of all the system in place. So this way, a strong step-by-step process is required to ensure the complete pharma quality. So in the pharmaceutical quality management, different departments are working hand in hand to ensure the quality. So the ensuring the quality is the responsibility of all the individual, all the personnel who are working in the pharma industry. So this slide where you can see it is talking about how ICH Q7 guideline it is insisting the need of quality management. So as per the ICH Q7a section 211, you can see they are insisting the need of the quality management. So as per ICH, it is saying that each manufacturer should establish, document and implement an effective system for managing quality. That involves the active participation of management and appropriate manufacturing personnel. So to implement, as per this definition, to implement a quality system, the participation of two group of people are required here. One is active participation of the management. When we are discussing about the implementation of GMP, we discussed about this. We need to have a committed management to implement the GMP into the production facility, and an appropriate manufacturing personnel, all the personnels or all the resources, including the human resources, need to be ready to implement such a quality system into your production facility. And when you are seeing the quality management, you will be able to see that in the case of quality management, there are different department works hand in hand. Sometimes we will be implementing a quality management system that is an integration of GMP like ICH Q7a, or it can be like WHO GMP, or depending upon the regulatory requirements, we will be integrating the GMP into the ISO. So ISO, when we speak ISO 9001 2000 series or ISO 9001 2004 series, which is talking about the quality management. And when you are seeing the quality management, you will be able to see a cascade of arrangement in the quality management system. And it is important to know the relationship between these cascade of activities and arrangement. So you'll be able to see the quality management, when quality assurance, then GMP, the production and quality control. So like this way, cascade of arrangement you will be able to see in the pharmaceutical production facilities. The quality management defining the overall policy of the organization towards quality is over everything else. And the next comes the quality assurance, which is the concept that ensure the policy is achieved. And the GMP, the next one is GMP. GMP is a part of quality assurance that we have discussed in previously. The GMP is the part of quality assurance. It deals with the risk that cannot be tested. It builds quality into the product, is it? It builds quality into the product. And finally comes the quality control as a part of GMP. So quality control is a part of GMP. So it is a part of GMP that is focused on testing of environment and facilities, as well as testing of materials, components and products in accordance with the standard. So we already mentioned that GMP, we are not just in the GMP, we are not satisfied with the end product testing. So in the quality control aspect, we already discussed quality control is a part of GMP. So through quality control, what activities quality control department will be doing? Quality control department will be doing the testing of various components. It can be the environment and the facilities, or it can be the testing of various materials like raw material or the finished products or the intermediates or the packing materials, the components and the product. And when the testing is done, everything will be in accordance with the standards. So this slide will be giving you an overview about the management, the quality management relationship. The next two slides, we are going to see the duties, maybe roles and responsibilities of the two departments, that is quality assurance department and quality control department. We have seen that quality assurance is a managerial policy and quality control is a tool used to assure the quality. So what are the main objectives of quality assurance? So you can see that the main objectives of quality assurance is to ensure the products are of quality required to their intended use and as stated by the regulatory requirements. So as per the guideline, it is pointing out the various responsibilities of the quality assurance department. The one responsibility is that sourcing of quality raw material. So we need to purchase good quality raw materials. There may be situations when the inspection team comes, they may be identifying a situations like buying of cheap quality raw materials because they are available on a very low cost. That need to be avoided, and the raw material should be purchased from the authorized vendors. And the hygiene of manufacturing areas. The quality assurance procedure should ensure the hygiene practices that is implemented in the manufacturing areas. So the hygiene will be assuring that the product is free of contamination. And also a procedure to eliminate the cross contamination. So only if you have a good facility design with the good HAVOC systems, you will be able to avoid the cross contamination. So the QA team need to implement, validate, and they also see the maintenance of the cross contamination. And also need to be clearly defined the manufacturing processes with a given written instructions. So each one's duty should be clearly mentioned, and they also need to get the specific job oriented training. So I already mentioned about another another role of the QA, that is about the process validation in accordance with the established procedures. And whatever the SOPs or whatever the procedures that are being written, it should be in a clear language. And if the training requirement also is another important area, a full training of all the employees involved in the process is another mandatory requirement. Even the quality control department, they need to organize training on their specific job role. So there will be able to see some of the overlapping job roles also. The detailed information we will be discussing when we are moving on to the module 1 about the quality assurance and quality control, how the total pharmaceutical quality management system will work, what are the different tools and techniques that is available to implement the quality assurance. And the batch to be traceable. This includes the distribution so that the drugs can be recalled if any necessary withdrawn of any products from the market. So there should be a good distribution practice. As along with the GMP, we need to implement a good distribution practice, a good documentation practice, so that any kind of recall, if it is required, that we can do, that will be helping in the traceability, the batch traceability. So if you have a good documentation, good distribution, we will be able to trace the batch. So batch traceability is possible. So complaints logged or any kind of investigation that is required need to be done by the quality assurance department. So when we do any kind of auditing, they will be able to identify the certain problems, critical issues. If they are able to identify, then there should be a possibility to do that investigation, and after identifying any problem through this investigation, we should be in a position to clear it. That means a corrective and a preventive action should be there. The corrective action and a preventive action should be available. So these are some of the brief responses or the roles that is to be done from the quality assurance team. So moving on to a summary of activities by the QC department. So the QC department will be performing the following activities. They will have some of the routine activities and the non-routine activities. So routine activities involve the raw material and the packed material analysis. So RM indicates for the raw material and PM stands for the packed material analysis, and intermediate stage analysis also will be done. some finished product analysis or the stability studies. So all these activities and the packing material analysis, the quality of the packing material need to be analyzed, the process need to be analyzed. So all those routine activities they will be doing. Non-routine activities like the calibration, then the preventive maintenance of instruments, which is belongs to their department, need to be done by the QC team itself. The preparation of references or the working standards should be done by the quality control team itself based upon the standards. They need to prepare the references and the working standards. And a method of development or the validation for their department also is a duty for the quality control. But these duties are non-routine, like calibration or the maintenance or development and validation. All these are non-routine activities. At the same time, there will be routine activities like analysis of packed materials or analysis of raw materials. It can be raw material when we say it is the starting materials, whatever they have purchased from the authorized vendors. That quality also should be ensured. And the intermediate stage analysis also we have to see whether the API is having the sufficient qualities, or if the drug is having the sufficient amount. Okay. So all these analysis they have to do. So for that, all these activities will be managed through instrumental analysis, chemical analysis will be doing. They will be also performing the microbial analysis and the package material analysis. These kinds of various activities will be done by the quality control team. As I mentioned, more details you can wait and watch till the videos are released for the first module. So going back again to the quality management, as by definition you can see what is quality management. The quality management is defined as the part of management function that determines and implements the quality policy. So the quality management, what they will be doing is they will be implementing a quality policy, and they will be also seeing that it will be implemented. So they need to make a quality policy, and also they need to see that the quality policies are being implemented. The quality policy is a statement by the top management of the company of its overall intentions and directions relating to quality. Formerly it was expressed as corporate policy. This quality policy, initially it was being expressed as corporate policy. So top management, when we say top management of a company usually includes the board of directors, the general manager of the company, or the plant, or the factory. All these belongs to the category of top management. So the overall intention of the quality management is regarding the quality as formally expressed and authorized by the top management. So in the quality management, there are two basic elements that is there. One is the working infrastructure. We call it as the quality system, that is equal to the quality system. And when we say the working infrastructure includes the organization structure, the procedures, processes, resources. So when we talk about resources, the resource management is an important element. Resource management means, when we talk about resource management, it may be the facilities, the human resources. So managing all this is one of the basic element of the quality management. The second thing is there should be a systematic actions to bring the quality policy to life. So it is nothing but a complete system of standard procedures. So there are normally these standard operating procedures are normally known as SOPs. They describe all the action that need to be taken in a standardized way. This means that everyone involved in the pharmaceutical manufacturing has a book of procedures that guide them in a way that they would do their job. So what is SOP means? SOP means each one working in the manufacturing area, in the facility, they need to have a written material, a written procedure that is available, that will be helping them, that will be guiding them in a way to perform their job perfectly, so that it will be providing a standardized way of working. So SOPs, simply we can say that SOPs provides a standardized way of working. So both together, totally, all these action what we are taking, we can call it as the quality assurance. Okay, so the working infrastructure, providing the working infrastructures, providing a systematic actions, that is in the form of SOPs. These two together, we can term it as the quality assurance. So if you see the principle of quality assurance, so QA, that is the quality assurance, is a wide-ranging concept which covers all the matters that individually or collectively influence the quality of product. So therefore, quality assurance is not a duty of one organizational unit in a company alone, but it is the responsibility of all the staff members who is in any way can influence the product quality. So we can say that it is the totality of the arrangement that will be ensuring the quality. So the totality of arrangement that we are making to ensure that the drug is of right quality for the intended use. So to achieve this quality assurance, we will need to incorporate GMP. So GMP will be helping you to do the product design and development, through which we can ensure that it covers the total arrangement that is required to ensure the product quality. Yes. So in the quality management, we already mentioned that we need to implement the good manufacturing practice. So good manufacturing practice is a part of quality management. So it is a part of quality assurance that ensures the product are produced and controlled consistently and reliably. This consistency of production and control is essential. It can only come about by having clear description of the way in which the work will be done. So GMP normally specifically will be addressing risk that cannot be fully controlled by testing the final product. We already discussed about this, is it? The two main risks that we can diminish using a GMP implementation are, one is cross contamination and other one is the mix up. Okay, so mix up and cross contamination, we already discussed about the cross contamination and mix up. What are the different types of cross contamination and what are the different types of mix up. So if anyone is having any doubt, please refer the previous videos where we have discussed about the cross contamination as well as the mix up. So through GMP, we can say that GMP is a quality standard which will be giving you a market authorization. Okay, so that's how we can highlight about the GMP. It is a quality standard. As a GMP is a quality standard. The good manufacturing practice is a quality standard which will be giving you the market authorization. Now coming to the basic requirements of GMP. So if you look into the basic requirements of GMP, there are various basic requirements of GMP. The first requirement is clearly defined and systematically reviewed the process. So we need to clearly define and systematically review the manufacturing process. So what does it mean? It means that all the batch documentation, all the quality specification and all relevant SOP must be prepared in harmony with one another. So what we need to do, we need to prepare batch documentation. about what? Quality specification and all the relevant SOPs. We need to prepare. How we need to prepare? In harmony with one another. That means all the department involved must be aware of the work of other department in order to eliminate discrepancies. Finally, the quality control staff acting as the overall coordinator of these activities should be involved in all decisions related to quality of the production. So that is about the first major element, that is clarity, defined and systematically reviewed manufacturing process. The second one is qualification and validation is performed. So that is another important point and another important requirement for the GMP to implement, that is qualification and the validation need to be performed. We already discussed about the different types of validation like design. I think we missed about one qualification called the design qualification. Design qualification is also a part of validation. The previous lecture I didn't mention about design qualification, I feel. So design qualification is there, then installation qualification is there, operational qualification is there, then process qualification is there. So all these validation we need to do it. Okay. Yeah. Then coming to the 5 essential P's. So these are the appropriate resources that is required for quality management through the implementation of GMP. So if we want to implement the GMP, the 5 P's, these are the 5 major elements that is required for GMP. One is premises, the primary materials, people, procedures, processes defined and recorded. The processes should be defined and it should be recorded properly. So these are the 5 P's. So this means that the company has elevated all the elements it needs to produce the product and has sufficient resources of right quality for its production. So if all these 5 P's are proper, that means the company has elevated all the elements it needed to produce the product and has sufficient resources to meet the quality of its production. So other elements, you can see the other basic requirement of the GMP. The other ones include the clear written instruction and the procedures. We already discussed about this. So it is another mandatory. So we also require the trained operators. So a company can have all the documentation in the world, but if its operators are not properly trained to carry out the task that they are supposed to perform, then the company will not be successful. So what we need to do is we need to give proper training for the staff. So this area we will be discussing more when we are discussing about the personnel in the coming classes. So training of the operator is another important aspect that we need to discuss. Then we also need to maintain records of actions, records of deviations, records of investigations. So when we do the corrective and preventive actions, so these are very essentials. Records of manufacturing and records of distribution, proper storage and distribution, systems for complaints and recalls. These are some of the essential elements in GMP. Similarly, as a personnel, as a part of the GMP team, when you are working, this particular slogan you have to remember in your mind always, that is communication with the management in a timely manner. It is very important. Like when you are performing any inspection, maybe you are a part of auditing team, the inspection, self-inspection team or the internal auditing team, and you have identified some problems. Immediately you have to report to your management, or you are getting a communication on regulatory inspection. The regulatory body is coming for their routine inspection. Immediately you have to report to their hierarchy, or any kind of deficiencies or deviations or any complaints if you are getting. Immediately you have to report to the higher management. So these are some of the points that we have to consider for the proper implementation of GMP. Okay, now we will discuss about how we can verify your organization is implementing the pharmaceutical quality management, the proper implementation of pharmaceutical quality management. So there are different tools through which we can achieve this, which more details will be shared in the first module. So here I would like to share two main methods that is used to check the implementation of QM. One is the internal auditing. So internal auditing is nothing but it is a regulatory monitor to see the compliance activities in the drug manufacture and to ensure rectification of these activities if deviation occurs. That means we need to have a system to see whether all the critical points are well covered, and also we have to see that if any deviations are occurring, then what we need to do, there should be a rectification activity. So this activities together we can call it as corrective activity and preventive activities. So CAPA should be there. So CAPA should be there. CAPA means nothing but the corrective action and the preventive action should be there. And the other one is the product quality review. This is another tool through which you can do it. It is to check the relevance and adequacy of the manufacturing activities. So if you do the product quality review, that will be helping you to see that the adequacy of the manufacturing activities and also the relevance of the manufacturing activities. It provides an input to update and improve the quality systems. So through this way you can do you can verify whether the QM system is being implemented properly or not. So next slide I will be showing you few informations through which you can make sure that how we will be doing this corrective actions. Okay. So it is a formal change control system. So what you will be able to see on the screen, it is a description of a formal change control system. So a change may be required when you identify certain problems. So you need to identify certain problem, the need identified. There is a need of changing certain processes or certain steps. Okay, so that is being identified. What we will be doing, we will be making a management for that. So we call it as a change management model. So as per this, we need to do certain preliminary analysis. If the change is needed, the change is identified, so some preparation we need to do. The preparation involves, we need to see that the estimated timeline that is required for implementing the change, the resources that is required to implementing the change, and what are the constraints associated with implementing the change. When you are implementing this change, is it going to affect the production of a particular process? Okay, whether we have to stop the production and then we have to implement, all those activities we have to consider here. So as a part of a preparation, the first main thing is we have to have a proper objectives. Okay, we need to have a proper objectives, and we have to ensure that the objectives are being met by the end of the change management. Okay, so if the need is being identified and if it is been checked that it is relevant and we can implement it, and we have sufficient resources to do the change, then you need to make a change team. The change team we need to make, and the change team will be getting the input from the different stakeholders. Okay, from the different stakeholders, they can take the help to make the change team, and the change team will be doing the comments of the change process. They will be doing the comments of the change process. During the change process, when they are performing, they have to do various kinds of activities. One thing what they have to do is risk assessment. So the risk management is another important area in total pharmaceutical quality management. So risk assessment they have to do. They have to, accordingly, they have to make a change plan. Then they have to do a schedule for the change. Then they also need to address the requirements like the proper SOPs, standard operating procedures for the change, the proper training, the validation. See, after an implementation of a change, immediately they have to do the validation. So all these kind of activities they have to perform. And then they will be getting the approval for the change, and they will be doing the implementation of the change as per the plan. And there should be a monitor to see that all the objectives of the change proposed is being achieved. So this kind of a process is called the change management. So change management is done when we identify certain what you say, you are performing a particular kind of auditing, a particular kind of internal auditing you have performed, and you have seen that there are some deviation from the complaints from the GMP, and you identify the needs of implementing the change, and accordingly you will be doing this change. So this is another information for your purpose, like how we can do a performance process, how we can prepare a SOP for a standard operating procedure for a process. So this is a flow diagram what you are seeing on the screen. This flow diagram is for the process flowchart, including the short description and responsibilities that is being assigned. So there is a clarity in this flow chart, like this is the start of the work. This is the where you can see here it is the start of the work has been highlighted over there. The equipment qualification is required in the start of the work. So this is a kind of validation here. Then you have to see the plan of actions. So when you say about the plan of actions, the assign the resources including funding, write the detailed project of plan including the timelines, all those planning you need to do. Then it is the design qualification. DQ indicates for the design qualification and the risk assessment. So here you can also see the responsibilities. So there will be a project leader to do the what you call as the design qualification. There will be people from the production department, project leaders. So all these will have different kinds of activities to perform. Okay, so you need to make a risk assessment. Based upon that, you have to see that user requirements, the design qualification protocol you need to do, that is a kind of validation of the design. Then you have to, at the end, you need to give a report on the DQ, that is the design qualification. Risk assessment report you need to give. Then it is about the installation qualification. So in the installation qualification, different engineers and project leaders will be involved. Then it is the operational qualification, then the process qualification, and the final reporting. Then if the final report says the process is okay, if it is okay, then we will be doing the release, and that is the end of the particular kind of process. So whenever you need to have a particular idea, we need to have such kind of a written SOPs with the responsibilities. So there is a clarity in the responsibilities of activity, who need to perform what kind of activities. So this kind of a standard practice we need to follow when we are having a GMP practice with us. So hope you have enjoyed the details about the quality management in the pharma system. So these are the brief information, and more details will be covered in the first module about the quality management. Now I think we need to have some discussion sessions, because to make all these classes more lively and viable, we need to have such kind of discussion. That is very much important, I feel. So we'll open the discussion. Moving on to the discussion, the first discussion session. I'll be putting certain photographs in the following slides. So what you need to see is how many GMP deficiencies can you find in the photograph of the following. So I'll be putting here 3 photos, and what you need to do is you need to identify. Even I think you can download it from the study material. The same PPTs are being attached there, and you can see the picture, each of the pictures, and you need to identify the GMP deficiencies. We have already seen what are the different elements that is required for the GMP, and what deficiencies you are able to see. Whether it is meeting all the quality requirement, then you can say it is meeting. So what you need to do is you can go to the chat box. You can open the chat box. There is a QA area. You can open it and you can start answering to the specific slides. Okay, this is the first one, the first slide, where you can see that the question is whether it is complies with 21 CFR 21142. So this is a US FDA guideline which insists the requirement of quality management. So we need to see by looking into the picture whether it is meeting or whether it is having any GMP deficiencies, or whether it is complies with the GMP. This is what your task. And similarly, you have 2 more pictures. So this is another picture, a very beautiful picture where the production is being one person is there, one personnel is there. So you need to look into the picture, a process, what is there, and you have to see that whether it complies with the quality, whether the quality management practices are fulfilled properly. Okay, and this is another picture. This also you have to see, and you have to say that whether it is complies with the GMP. So these are the 3 photographs that is being shared with your discussions. Even we are not in live, so I know that I won't be able to see your descriptions now. So once you start watching the video, immediately you can start answering to these 3 questions: what you identified and what kind of actions are required. As a GMP expert by now, you know the basic principles, you know the basic elements, and you have studied about the quality management. So watch the picture and identify whether they are following the good practices, okay, whether all the good practices to ensure the quality. And followed by this, there is an assignment. So what you have to do in this assignment is also posted on the website. So what you need to do is you need to imagine you are inspecting the pharmaceutical company for complaints with GMP. Consider the situation in the next slide. And what you need to do is you need to describe the action to be taken in each of this case. Okay, so this is your assignment. You can submit in the form of a Word document, or you can also submit in the form of a PPT. There is no problem in any manner. You need to identify. So you have identified certain problem. You were a part of your internal auditing team. Okay, when you are inspecting, you are a part of auditing team, and you identified certain problems. And the problems are, already I have mentioned about the issues. One is the quality management manual is not established in writing. So lack of qualified people is another issue what you have identified. Process not properly validated. Poor SOPs or the standard batch documentation. Standard materials deliberately purchased. Substandard materials deliberately purchased. Yes. So these are some of the issues you have identified, and what you need to do is you need to describe the action to be taken in each of this case. Okay, in each of this case, what action need to be taken. So use your logical mind and answer. So hope This will be making the video more interactive. Hope you have enjoyed today's class. Stay tuned and keep watching.